Welcome back. Still watching Beautiful Day. This is Weather HQ. Now, this week, the country observes Obesity Prevention and Awareness Week. As declared under Proclamation number 162, obesity is a serious health issue linked to diabetes, heart disease, and other conditions. But it can be prevented through healthy diet, regular exercise, and of course, lifestyle choices. Now, to know more about this important topic, we are joined via Zoom by Dr. Daveric Pagsisihan from the Philippine College of Endocrinology, Diabetes, and Metabolism. Magandang umaga, Dr. Dave. Thank you so much for joining us on Beautiful Day.
Hello, good morning, and a good, beautiful day to everyone.
Doc, let's start off first with this Awareness Week, Obesity Prevention and Awareness Week. Why is it important for Filipinos to start observing it and bring up awareness when it comes to the problem of obesity?
Yeah, because year after year, the number of people with overweight and obesity condition is actually increasing. So since the 1980s up to this year, the numbers are increasing, and more than just being, let's say, bigger, having more fats in our body, we also see that there is a increasing number of people developing obesity related conditions like hypertension and diabetes. So that's why it's very important to talk about obesity.
You know, you talk about obesity, Doc, and you mentioned since the 80s, tumataas nga siya in terms of the number of people who are considered obese and or overweight. You mentioned some of the common health consequences a while ago, Doc, but then what are the others that people have to be aware about when it comes to being obese and of course yung mga consequences po niya?
Yeah. So aside from the usual developing diabetes, hypertension, cholesterol, there are also other conditions related to obesity like fatty liver, which later on can lead to liver cirrhosis. You can also develop early osteoarthritis. So you may have this knee pain and joint pains at an early age. And right now, obesity is also considered to be risk factors for about 13 cancers already. So those are the things that we also need to take into consideration when we talk about the consequences of obesity.
Doc, sinasabi ng mga ibang Pinoy or when we talk about obesity in the Philippines in general, mahirap kasi, well, really, i-reduce yung kanin. When we talk about
Correct.
yung lifestyle changes or environmental factors rather or yung culture ng Philippine cuisine or Filipino habits, what contributes to yung obesity natin that you find a bit difficult for your patients to address?
Number one, it's cultural, no? So, we are taught kasi to eat rice, diba? So, we eat rice 3 times a day. Some people eat them 4 to 5 times a day. So, yan talaga kasi ang staple food ng mga Filipino. And rice is rich in carbohydrates. So, that's one. Also, as an industrialization comes in our country, of course, the quality of food that we eat also, diba? Yung mga food apps that are available, all these different food businesses available, they come up with different tactics and marketing strategies to make you order and eat their food. So it's the quality and the quantity of food that we eat over time.
Mhm. Tapos may pasalubong culture pa kapag may umuwi galing probinsya, may
Yes.
palaging
We
may
also
dala-dalang
like to eat
sweets.
we also like to eat, let's say, carbs on carbs food. Let's say, rice, ulamin pa natin yung pansit. So, yung bread, papalamanan pa natin ng pansit. So, those are the things that we should really be looking into.
Doc, maraming natamaan dito sa studio. When we talk, when we take a look at the recent COVID-19 pandemic, maraming umiba in terms of yung health habits natin, in terms of yung mga fitness po natin. Have the obesity rates actually been affected by the COVID-19 pandemic, especially with the changing lifestyle habits? Kahit masasabi natin that there have been a segment of the population that have started living a bit healthier since then.
Yeah, comparing the number of people with obesity, overweight and obesity, let's say in 2019 to 2021, medyo tumaas siya. So right now, the adults now, 4 in 10 adults, no, that's 20 years old and above, are at least overweight. So dati kasi mga 3 lang yan. Ngayon, 4 in 10 na siya. So with the pandemic kasi everything became more convenient. So lahat online, and then yung physical activity was really restricted to the house na lang. And then more work shifted to work from home setup. So wala na masyadong naging physical activity. So those are the things that I think changed as we worked on the pandemic.
Mhm. Another thing, apart from yung cultural aspects of obesity here in the Philippines, there's also the environmental. There are obviously mga prolonged bad weather, prolonged rainy season na nararamdaman natin, and because of that, a lot of people suddenly stop moving in terms of yung activity level nila, and of course, just generally staying healthy. Are there any practical steps or ways that you would suggest to adults or even kids to be able to maintain that healthy weight, and of course, prevent gaining anything, especially during the rainy season where, aminan po natin, masarap sa kama lang the entire time?
Yeah, mahirap 'yan lalo na kapag yung weather hindi nakikisama, no. But the number one thing I tell to my patients, it's not really about your diet or your exercise, but you have to be consistent. So let's say you decided on to do a certain diet that would help you improve your weight or do some physical activities that will help you reduce your weight. It's really the consistency and the drive to do it every day. So, kahit nasa bahay, basta meron kang goal, meron kang determination, you have to be consistent in doing what you need to do to maintain and prevent gaining weight.
Doc, I also want to talk about childhood obesity, and especially, and even those who are adolescents, because right now, there has been, at least if you look all around the world, especially in the United States in particular, a rise in that particular sector. Dito po sa Pilipinas, is that a problem?
Yes, similar all around the world. Parehas pa din. Yung sa childhood obesity rate several years ago is about 11%, no, for children. Now it's about 14%. So that's a 3% increase in the past, I think, 3 or 4 years based on the national survey of DOST. So malaking factor dyan kasi yung diet din, no? The weight of the child is often influenced by the lifestyle of the parents. So usually kapag tumataba rin yung parents, no, poor lifestyle, the child gets to imbibe those lifestyle.
Mhm. So, Doc, kung sinabi ko sa mga magulang ko pumayat sila, wait, sorry, hindi na pala ako children. When we talk, take a look at you mentioned that yung parents have play a big role, but what about teachers, yung faculty, being able to influence their kids, considering the fact that, well, most of the day they are in school? Gaano ka-importante yung a good diet within school hours, especially during school season?
Yeah, two things dyan ang important is number one, teaching them how to eat healthy. So kasama dyan yung education. So dapat kasama na sa mga lectures kasi yung healthy education and the effects of obesity later on. Kasi minsan inisip nila they're just children, so they can eat whatever they want, they won't develop any of these conditions, but in reality, some of them really do develop conditions really very early.
Mhm.
The second one is the food that they eat at school. So yung mga nasa canteen, so kailangan din ma-improve din yung mga food choices, no, that these children can get from the school.
Mhm. Doc, when you take a look at the habits of Filipinos, do you feel that the government actually needs to have policies to address this particular problem, yung obesity? Obviously, recently, si President Ferdinand Marcos Jr. Has coordinated with the PSC, courtesy of Sir Pato Gregorio, to open up sports facilities to be able to encourage more activity for Filipinos. Do policies like this, do you believe, help in terms of addressing yung obesity problems natin? Or does it have to be a bit deeper than that to address yung cultural problems po natin?
Yeah, it's really very important that all sectors in the country would be involved in lowering the numbers of people who are overweight and obese. Hindi lang naman mga like societies like ours, no, yung teaching everyone about obesity not only in school, hindi rin yung mga teachers, but also yung nakikita natin sa paligid. And these are usually mandated by policies from the government. So maganda yun yung increasing yung sports facilities where everyone can enjoy and do sports on a regular basis. But more important also would be promoting a healthy lifestyle all around the workplace, all around the community. Let's say we create more parks where people can walk every day, or we create more walkable cities so that people would be able to walk more rather than commute pa. So yun yung mga importante. Pati yung mga policies regarding sugary drinks, the number of calories in foods, those are also very important.
Mhm. Doc, before we let you go, syempre, a lot of people will be looking at this. Okay, I may be bordering on overweight, or I might be there, or might be already obese. Are there any myths that you feel need to be debunked right before we wrap this up?
Yeah, obesity is actually is preventable. So, minsan sinasabi nila kasi malaki na ako, bata pa lang ako, or my parents are also big, so that's why I'm also obese at my age, no? You can do something about it. There are things that you can do like getting the right nutrition, doing the physical activity. There are also medications that can help you lose weight. So, hindi lang yan because of the genes eh. So, it's also because of the food, of the choices we make every day.
So in other words, it is preventable, it is actionable, and no one is actually born obese. Tama po ba yan?
Yes, we have a choice on what we can do as we grow old. So we can reclaim naman a good weight, no, as long as we are really dedicated, determined, and consistent.
Doc Dave Pagsisihan, thank you so much for joining us and sharing your insights. And hopefully, we can help address the problem of obesity and being overweight this month, especially now that we're trying to raise awareness. Maraming salamat po. Thank you so much.
Thank you. Good morning.
So